Welcome to Know Your Rights podcast. My name is Yaukai, and on today's episode, we're focusing on the right to health. And to do so, I am joined by the beautiful young people right here. Kindly introduce yourself.
Hello everyone, my name is Esnara Kativu. I'm from Shamwari Manaskana.
Hello, I'm Ibet Chipongodze from Vision Africa.
All right, thank you so much. So to understand better about all this discussion we are having here, let me just read through the background that we have. So the right to health is enshrined in the Zimbabwean Constitution under Section 76. It guarantees that every citizen and permanent resident has the right to access basic healthcare services, including reproductive health services. The state is obligated to take reasonable legislative and other measures within the limits of the resources available to achieve the progressive realization of these rights. So so far with what I've explained, I'll continue going through with the rest of the discussions. What are the most significant health issues affecting youth in your communities? I'll start with you, my dear friend.
Okay, I think issues to do with sexual and reproductive health affecting a lot of young people in our different communities. From the work that we do at Shamwari Manaskana and the different programming areas that we are in, we are seeing that it's becoming an issue. There are a lot of teenage pregnancies, a lot of STIs, and even HIV prevention is becoming difficult because the youth, they don't have access to information, they don't have they have limited access to health facilities, so they cannot get the help that they need when it comes to issues of sexual and reproductive health.
Okay.
For me, the issue is a bit different because access to health, people can have it, but the challenge is now about the commercialization of health services. Because when you see, maybe look at our government hospitals, most of the things the young people have to outsource. So it's not an issue of young people, them seeking health service, but it's also an issue about them also, they're also breadwinners within their families. So the income they have with the Magweja, people just try to capitalize in our communities on small challenges. So the price of medication, the price of prescription, the price just skyrockets. So these are critical issues, especially the pricing mechanism of health facilities, especially on medication. It's beyond the reach of many young people. We talk of bandages, syringes, because the hospital, they will just diagnose, they tell you buy A, B, C, D. So at the hospital pharmacy is cheap, but outside on private areas, it's not expensive. So it's really a difficulty that young people are going through.
Oh, yeah. Maybe to just add on to just cement my colleagues' contribution. There's this thing that is happening in public hospitals, public facilities, which are supposed to cater for health rights for all citizens at maybe a low cost. They are maybe, I want to get really free, but because of different circumstances, they are supposed to charge just a small amount of money. We find my doctors in those different facilities, they will, if you go there with a problem, you're a young person, aside and they tell you, I can assist you at my private facility. You won't get the help that you need. So there is that challenge now. When you go to that private facility, you probably can't afford it. We won't attend to you the way that we are supposed to. So if you want our full attention, private. So that's those are some of the challenges, and those ones, they actually affect especially teen mothers, especially when it's time to give birth. Public hospital, and maybe there are complications that happens there, and they try by all means to channel that person to a private facility so that they can make a quick buck, and it's affecting a lot of young people.
Okay, thank you so much. So against that background, I'm gathering in the streets that people with disabilities are actually also being affected with this unfair, or how you'd rather call it, I don't know, they are being affected with this health system. Others are saying that there are people with dwarfism and the beds they can't access. Others are saying they are on the wheelchairs and they also can't access without help. And it also infringes onto their rights of privacy. You can imagine someone having to push you. So against that background, internationally, the right to health is affirmed by instruments such as the Universal Declaration of Human Rights and the International Covenant on Economic, Social and Cultural Rights, right? How can young people advocate or better healthcare services and policies? This time we want to take this angle where we are talking about people with disabilities. Then you can add also the general youths.
So I think let me come in. I think the issue of advocacy, it's a broad word because looking in our environment, health mainly was prioritized. Maybe if you look for the past 10 years that the civic sector was operating, their main focus was on reproductive health at the expense of other issues like health infrastructure, trainings, issues to do like procurement of medication of other non-communicable diseases. So when you look at people with disabilities, now it becomes an infrastructure issue that does our institutions have disability-friendly spaces. We are not talking of people who are only paralyzed or crippled. We are talking also of people maybe who cannot speak or hear. Do we have health professionals that are able to interpret or understand sign language? Or do you have health professionals that can assist a blind person, braille, etc, etc? So I think that the aspect of advocacy, it's a broader term. And also if you have to take it closer, the things that are affecting the able-bodied is also affecting disabled-bodied, because it all zeroed in the issue of economics of the day. Things like family planning pills, etc, they are provided for free. Things like vaccination for children from 0 to 5 years, it's for free. So now when you look now at other ailments beyond sexual reproductive ailments, maybe you're talking someone has suffered from accident, physiotherapy, rehabilitation, it's totally different. So the economics and the funding, I think for me the critical issue is funding on the activity, on the grassroots, from the clinics to the hospitals.
Yeah, I also think when it comes to issues of advocacy, especially for young people looking at issues of disability, I also think that it is key to have persons with disabilities involved in whatever initiatives that we might have as CSOs, CBOs, as the government, to give them that space to speak for themselves. Because I cannot represent I can represent a blind person, but I cannot fully express and fully represent a blind person, because I do not know the things that they go through. I cannot relate to their experiences. But if we give them that platform to also speak for themselves, to demand the rights that they have, which are enshrined in our constitution and in the different statutories that we abide to, I think it can bring change. And also when it comes to young people advocating, I think it's also key that they are capacitated with information, health information. I'll give an example of the PrEP that we have now. We have a lot of youth-led organizations who are into HIV prevention, who are into SRHR. But if you go there and ask a programmer, can you tell me about PrEP, how the percentage of its effectiveness, they do not know. But if we have that nature of capacitating people who are into the community, behavioral change, massive civil society spaces, the young people, it will become easier, because we not the relevant information, the true information. Because ukaenda usina that knowledge, a young person, yes, young people, they are very influential. I go there and start talking about PrEP, it's really wrong. It might affect the next young person. I'm not told that wrong information, but if we continuously capacitate youth-led organization, young people in the space, it will become easier when it comes to issues of health.
Yeah, and I agree with you. I think one of the major challenges is how information is disseminated. It's what
is disseminated.
I think we are part of the problem. We as young people, I think they failed to interpret our education into the language that some of us can buy it. Because that's why you hear them said, but yet the challenges are nominal. So for me, I think one of the policy advocates we can work on starting right now, I think our hospitals are overburdened with issues. So I think one of the things is that we need to capacitate our clinics to address certain like small operations, address issues like small theaters, than to say just a small injury to the hospital, see the doctor. I think we need also to capacitate our community-wide clinics so that maybe even in the education sector, we can have many doctors. People can do certain kind of operations. Because you see, one doctor is waiting maybe for 6-7 operations in a day. And at the end of the day, the effectiveness will no longer be there. That's maybe why we have these issues of where women are dying in labor, children are dying in birth, because it's because of the workload.
Yeah, and maybe to invest again in issues of community health.
Yeah.
To focus mainly on prevention. We have Anambuya Utano, but Anambuya Utano, they are just there to mobilize people for the meetings that we want to have. But I believe that they have a bigger role to push issues of prevention when it comes to health issues. So if we try to revive that system, it will also help us in when it comes to the issue, health rights.
All right. Thank you so much for this discussion. As we wrap up, I'm getting what you're saying. Zimbabwe is subscribed to the Universal Declaration of Human Rights. It has its own constitution, but however, things are going the other way. And also in some spaces, young people are also talking about online protest where we document video, whatever is going on, just take a video, make sure you're safe and publish it. That way, I think there's evidence against what you're saying. So can you just share an example of a successful health-related campaign that has been led by youth, maybe in your community or something you've seen that can actually influence and help someone out there who is actually in this sector?
Yeah, for me, I was part of the one that was called Youth Perspectives in between 2020 to 2021, the COVID time, where we advocated in the Parliamentary Portfolio Committee on Health, where we said that since Zimbabwe is a signatory to the Abuja Declaration, that 15% of the total budget should be allocated to health. The Honorable Minister of Finance should also put it into context. And we hope that in 2021, in the national budget, they managed to put 15%. Although the 15% didn't go where we really wanted it to be, because when you look at the Parliamentary Portfolio Committee on Health, they will tell you that about 80% of allocation goes to curatorial activities. That's administrative.
So Rick, let me hold you right there. So you're saying 2021, and now we're in 2024.
Yeah.
So between all this period, we don't have anything similar to that, or it was just that
one? It was just the maintenance of the 14-15%. But the challenge was now the allocation would go more on curatorial activities, that's administrative, than activity-based on the ground at the hospital. Like maybe you are working on renovation, we're working maybe on the benefits of the health workers, we are working on the procurement of drugs, or working maybe on the procurement, or even outsourcing specialist doctors for the work we want to do in our institutions.
Okay.
Yeah, well, maybe for me, something which is outstanding is related to students in the tertiary institute. I believe there are organizations like Say What, who are they pushing issues of HIV prevention. We all know my university's issues of HIV are something else. So I think those clubs that they do, I know of Bindra University where I went, there's a club that is there. They normalize conversations around sex and pregnancy, protecting yourselves during sexual activities. They normalize those conversations so that it becomes easier for people to ask questions where they do not understand, to go and access health facilities. So I think that is something that we can, as young people in our communities, learn and adopt from. Even in churches as well, we can learn and adopt that model to say things about sex. It's natural, they're there. We have to make those conversations open. We have to make them safe for people to ask questions, for people to have that knowledge. That's the only way that we can actually preserve our health and contribute to SDGs. SDG 3, I think, on health. Yeah.
So there you have it, dear listeners and viewers. It was nice having you guys. So as we part, I want us in the back of our minds to also think about young people with chronic illnesses, BP, sugar. What are we saying to that? Because currently our government recognizes the elders or the elderly as people who suffer from those. But what about us, the youth? We also need those subsidies and to benefit from free health care. BP. So as we part, can we also provoke and poke conversations around those so that we can actually all be free and access health freely? So thank you, everyone. This was Know Your Rights podcast, brought to you by Yet. Thank you.